Hi, everybody. François Picard here with another confined edition of the France 24 debate. It was speaking to a commission of the French Parliament that the Prime Minister, Edouard Philippe, on Wednesday used the word for the first time, deconfinement, the path to ending the lockdown under which France and many of its neighbors are is a long one, and we're going to be talking about it now with our guests, Séverine Toussaert, who is a behavioral economist at Oxford University. Thank you for joining us from Oxford. We're going to be talking in a minute about the study that you participated in.
Yeah, thanks for having me.
We also want to welcome at this point Fabrice Epelboin. He teaches at the French Political Science Institute, Sciences Po, and also the co-founder of Yogosha, the data security consultancy. Welcome to the show, Fabrice.
Thanks for having me.
Yeah, the French Prime Minister on Wednesday, as the number of casualties, as the number of those infected from COVID-19 continues to rise, for the first time addressing how we can get out of this confinement. Let's listen.
Il est donc probable, je dis probable et j'essaie d'être
We're probably not heading towards a universal, absolute end to the quarantine for everyone at the same time.
Et absolu en une fois partout.
We're currently working on and trying to understand the different scenarios for how to end the quarantine. We should remember that first and foremost, we need to discuss how best to end it.
Let me get your reaction, Fabrice Epelboin, to the Prime Minister effectively saying that, well, one of the ways we're going to get out of confinement is by being able to track those who have COVID-19.
Well, unfortunately for privacy activists like myself, so far, I don't see any other way. So the question is going to be how is this data going to be handled? What guarantee can we have? And how long is this going to last? And this is a medical question, because if it happens to be a seasonal virus like the flu, we're going to be living forever with this kind of technology. So this is a very important moment, because this will be a cornerstone. The society after everybody's using these kind of app is going to be very different. And of course, they're going to be used for medical reasons in the first place, and they will soon evolve into something else. And this is going to be a major problem also. So the sooner we ask the good question, the sooner we might have a legislation that will enable this app not to be such a threat to our democracies.
All right, we're going to get some of the political reactions to that. But Séverine Toussaert, there you hear it. Fabrice Epelboin, privacy rights activist who's been on with us many times to call out instances where people's rights are being impeded, saying, yes, this is the way to go. And that's what you discovered in the study you conducted across Europe.
Yeah. So I really want to say that first, I mean, there is some trade-off here in terms of how much data we encrypt, how much data we collect, how long we save the data. But Germany tends to be actually very, very much concerned when it comes to privacy for historical reasons, thinking about, East Germany and the Stasi, for instance. So they're really, really, have this in mind very much when it comes to collecting data that would allow to track people's location, for instance. However, lawyers, parties, the Greens, for instance, the Green Party in Germany now really supports this type of approach. And we'll probably have the occasion to talk more about how we could do this in a way that actually preserves privacy. But so we've conducted a study with an online panel in 4 different countries: Germany, France, the UK, and Italy, with 1,000 respondents, basically asking this question, how much would you be willing, or what would be your chances of actually installing the app if it existed, okay? And we realized that across all these 4 countries, there is a massive yes in terms of installing such an app, okay? So we gave a short description of what the app would do, And maybe we can go back to what are
let's talk about that for 1 second here. The app, according to the Prime Minister, and we heard as well the head of digital affairs at the European Commission, Thierry Breton, talk about this. It would be an app that would run on Bluetooth, and that would not store your personal data.
Yeah. So yeah, let's think just like what's the basic principle and what can be done. So here, on the basic idea is you install an app on your phone, and then the app will recognize other users that are in your environment that you have been in close contact with for at least, say, 15 minutes, or what is seems to be relevant from an epidemiological point of view. And close contact meaning, for instance, 2 meters apart. Okay. And then if one of your close contacts was diagnosed with the virus, you would receive a message alerting you that this person got the virus. This person, meaning, I mean, you would have an anonymized, ID that would be saved in your phone, so we'd never know who was this person, what the identity of the person was. But basically telling you, well, please enter in self-isolation, protect your family, your loved ones, anyone else you could enter in contact with from getting the virus. And that's actually really important for the following reason, which is that we might actually carry the disease and be infectious even before actually feeling the symptoms, okay? So the fact that we are asymptomatic is actually a big problem for this virus. Okay, and previous versions of this virus did not necessarily have this feature, but we can transmit very easily the disease without even knowing it. So the advice of just entering in self-quarantine here seems to be a very important thing to do, trying to be ahead of the curve instead of always being behind. And
let me bring in Fabrice Epelboin on this. How does that sound to you? The way it's sold, if you will, by Séverine Toussaert?
Actually, it's a bit more complex. For example, we could totally design an app that would bring me anonymous data telling me that I've crossed the path of someone anonymous who has the virus. That's not a major problem. But the entity who will collect all these apps will have the possibility to de-anonymize anything. This has been proven many times. So whatever the app is, we will hand those data to various entities, states, Europe, or whatever, who will be able to de-anonymize those apps. And this is life-changing for our democracies.
Mm-hmm. Yeah, so I mean, I think trust is going to be incredibly important. So
yes.
What type of authority is going to have to deal with this? And there is here really, it's going to be country by country response.
And that's a very important point. Trust is going to be the cornerstone, both on the tech level and on the political level. For example, Singapore open source its app, and that's a big thing in terms of trust. But when we come to Europe, not only open source and free software is not really the way to go in Europe, but we have basically 2 entities. In France, we have the French state and Europe. And as of today, nobody really trusts those entities. So there will be a major problem in terms of trust, especially in France, who is probably the country in the most dire situation when it comes to trust.
Let me ask Séverine Toussaert, specifically on that point. What did respondents in France say compared to the other countries?
Yeah, so I was incredibly surprised actually by the response that was given by our participants. Obviously, there might be issues of selection, the fact that we're dealing with an online panel, how we can discuss all these things. But when we ask people, so how inclined, how likely would you be to install in this app if it existed? 80% of our respondents said they would probably, or even without any doubt, install the app. Okay, so that's the first thing that we've realized. The second thing we asked is, suppose now actually there is another policy you could potentially consider, which is automatic installation with the possibility of opting out. Okay, and even then, actually fewer respondents would want to follow this policy, but nevertheless, a majority said yes, the government should do this. So I think there's something about the urgency of the situation that makes people really take this into account. And however, I would like to emphasize the following thing, which is we also ask people about whether their opinion of the government would change if such a policy was implemented. And here the message is much more mixed. Okay, so I think it's incredibly important that there be an independent authority in charge of this to actually promote and explain to the public.
So let me just ask you a personal question on that, because as a French citizen living in the UK, here in France, what we've witnessed is there's been a lot of second guessing of the government since the beginning of confinement. Confinement is more recent where you are, so we're not at the same point yet in Britain. But are people generally trusting the government more than they are in France?
A little bit more. So across all 4 countries, it seems indeed that France's, trust is at the lowest point when it comes to the government. So I really feel like, especially in France, there is a need to identify an authority that will be able to transmit this message, that will have this transparency that we need, this independence relative to the government. I think that will be really essential. But I think that overall, we actually see very little variation across countries, which we were very surprised about, and very little regional variation. For instance, in Italy, we expected that actually would be much more, difference, and that's not the case. So no matter who you're talking about, whether we're talking about women or men, age categories, everything, it all transcends all those differences. There is fairly strong consensus in terms of the usefulness of that.
Yeah, so privacy, Fabrice Epelboin, is it something that kind of goes out the window when you're in a situation where you're facing a mortal danger, as we are with this COVID-19 pandemic?
Definitely, just like terrorism. It's always during a crisis that you have a shift in acceptance and the way the government is going to control a little more of what used to be public freedom before. And this is not only a great crisis, but a great opportunity to enter in an open way, in some sort, a new world where everybody would be tracked, because there is some real reason. Are some valid medical reason, but I really couldn't stress more that there will be other very good reasons for security, for many other things that will enable those tracking apps to evolve. One of the major issues is purely medical. Is this virus something that will come back year after year like the flu? Are we going to live with those apps for a very long time? Or are those apps going to be thrown away in 5 or 6 months? That's a very, very different situation. And this is something we have to ask ourselves and ask our government right now, because the decision we're going to take about those apps today will change and affect in a very hard way our society if this virus is to be something as familiar as flu is today.
Séverine, Toussaert, how does the future seem to you?
Yeah, so I totally agree with this. I think we definitely need to think, the current situation, we're definitely not out of it, right? There is a risk of new outbreak, and having actually, an idea, collecting data to understand the spread of contagion and potential risk of a new outbreak, I think is incredibly important, but obviously also for the future of new, epidemics that could be coming. So for instance, we asked one question in our study about saving data and reanalyzing this data to prevent future epidemics. And in fact, there is also a lot of support for a policy that would consist in saving in an anonymized way all the data that was generated by the app for research purposes. Okay, so a majority of people actually support that across all 4 countries.
A majority of people think this can be anonymized, which is not the case. This cannot be anonymized. So whatever the data is, even if it's 5 months worth of data, and then we stop those apps, those data will not be anonymized. Whatever the government tells you, it's impossible to anonymize that.
Right.
Well,
so I think it's really
you mentioned Singapore, Fabrice Epelboin. There's also been places like Taiwan, Hong Kong, South Korea. How has it looked so far on that score?
As of today, there's something like 30 different initiatives worldwide about tracking apps all over the place. And there are some states like, well, mostly Asian states, but also Israel are pretty much ahead. When it comes to Europe, you have projects. They're actually in the process of building an app, and you got to wonder, how do you build an app without specifics about the app, about the way data is going to be handled, about the way where data is going to be shared? Because this is the very first thing you do when you code an app. Think about the data and the way it's going to be used, and then you code. So I find it difficult to imagine that people are actually building an app and other people are thinking about those problems, because those problems should be solved beforehand, theoretically. And of course, we're in a crisis. So things are going to work in a very different way. And this is quite dangerous for our freedoms tomorrow.
Séverine Toussaert?
Yeah, so I'd like to just point towards a website now that exists that's just very recent. That's the website of the Pan-European Privacy Preserving Proximity Tracing website. Basically lays out a framework for GDPR compliance, for instance, to be met here, trying to understand what are the basic fundamental principles that on which the approach needs to rely. So, privacy, voluntary participation being one of them. How are you going to preserve anonymity? I mean, so there is a notion of anonymity vis-a-vis, like between users of the app. So that I think is something that most people actually care about, right? Am I going to know who got the virus, right? Personally, that I think is really something that we need to ensure, and this is actually something that we can do, right? So, so they have a framework that they lay out, and then I invite everyone to look at that potentially could provide an architecture for every European country desiring to use such an app to actually do that.
Yeah, so there's several points there, because you see, as Fabrice Epelboin just said, you don't have a pan-European app yet. So you're saying these could be some of the criteria for building one. But we do see apps already in use. In Poland, for instance, there's an app they've been using now for more than a week, where those who are positive have to download the app or else face a fine to prove that they're remaining in confinement. Séverine Toussaert, your thought on that?
Yeah. So very different societies will have very different views in terms of the level of paternalism, for instance, you want to impose in a society. So there are like cultural determinants that are very important. Norway, for instance, just said, yeah, okay, let's just have this automatically installed on people's phones, like you cited the case of Poland. I mean, in Asia and many countries, and they went with a very strict solution here. And obviously, that's for every country to determine in many ways. So there are also other issues in terms of integration, right? Every country has different types of health services. How are we going to centralize the information? All these things will require a country-by-country response.
I know where you are in the UK, they've deemed it legal to have a tracking of people to make sure that they're respecting the rules of confinement and only going out once a day. Your thoughts on that, Séverine?
Yeah, so again, I think this is something that needs to be brought to the public to debate, right? I think this is really important. That's why I'm very happy that we have this discussion about what are the different options and what potentially can actually work in the long term. In Asia, the rules were incredibly strict. It seemed that they helped somewhat, but also this is not something that we could see in democracies in Europe. As culturally, I don't think this is something we can even consider.
And what do you think of that idea? Is it a good one?
Well, I mean, I think again, like I would want to follow the opinion of the majority in terms of what it is that people can support. I think that when measures are very strict, then we have to worry that people are not going to comply with orders. So I think this is something that needs to be taken into account, and that's why we asked the question of voluntary installation versus automatic installation, because it needs to be sort of a team response in many ways in a situation of crisis like this.
Such an important point you're bringing up there, which is what do you do as opposed to a hard lockdown like we've seen here in France or in Italy, or a more flexible form of confinement, as we've seen in Germany. We can show you this report by our Berlin correspondent, Nick Spicer.
They've been lining up since 6 a.m. for the test. Across the country, hospitals and clinics are working overtime. 100,000 tests are done every day in Germany, a massive program that helps prepare for the pandemic. It's obviously not the tests that save lives, he says, but very early testing does allow us to detect infections quickly, which enables us to limit the spread of the virus and keep the contamination level low. Massive tests, but also quarantines and early steps to keep people at home, all helped Germany keep its COVID-19 mortality rate at a very low level. The Chancellor herself went into quarantine after treatment by an infected doctor and called on her fellow citizens to stay the course. Stick very closely to the rules, she said, and as much as you can, limit all contact with people outside your home. It's a successful strategy for the German leader. 89% of people here approve of the government's management of the crisis. For now. The confidence she inspires may not last forever, he says, because a lot can happen still. The situation can get much worse very quickly and cause enormous problems. There can be economic, social, and family difficulties. For the time being, Germany has seen fewer deaths than its neighbors, but scientists and the government aren't letting their guard down, because the COVID-19 mortality rate, low as it is here, is still slowly but inevitably getting higher.
Yeah, Fabrice Epelboin, the German strategy vis-a-vis the one here in France of getting that testing done early as January, and really targeting little epicenters.
Well, it's like we're in mask. You have to afford it, but we weren't in a situation where we could have such a strategy in France. So we had, well, obviously a third world country strategy. And obviously Germany and of course Singapore, South Korea are showing the way. They are much more modern in terms of how you should handle a pandemic. They have more experience. And we were not prepared at all, but I think everybody knows that by now in France. Right now, we're facing a situation where in Europe, where Europe happens to be non-existent at the time. And those apps show another problem that we all knew about Europe. Every country will have a specific app because it's a specific culture. People are not willing to accept the same thing from their government from one European country to another. But still, we will have to share the data among European countries if we want to handle this epidemic. It's going to be very difficult to both do some local app that will be acceptable and used and not entice some, I don't know, public oustings and massive demonstration against the government. And at the same time, sharing those data on a European level. I can't imagine two very different countries like Hungary and or Sweden and France doing the same thing with their population and gathering the same data, therefore being able to share some useful data with their European counterpart. This is going to be a problem.
Séverine Toussaert, is this make or break for the European Union when you have just a simple thing like this about whether or not you use tracking apps?
Mm-hmm. Yeah, I mean, I think, so I totally agree. I think this is a major challenge. The initiative I was telling you about, so this PEP, Pan-European Privacy Preserving Proximity Tracing framework, I think has a lot of potential. It won't bring all countries together that I can foresee, but I think that it will allow at least, for instance, Italy has been in contact with, I think, the developers in Germany, and there are a lot of conversations that maybe we haven't heard of about how things could be implemented as at a global scale. The German version has thought a lot about encoding of IDs that would have one component of it that would allow us to track what country the person comes from. So that, for instance, when we reopen borders, and we can actually have, some communication, centralization of the information. But at the end of the day, the backend will be there, but the app itself because there are differences in terms of healthcare systems, for instance, and how we're gonna actually collect this information about testing, right? This is going to be country-based. So there are challenges here for sure that have to be addressed in many ways.
You heard of Fabrice Epelboin. Is it impossible to harmonize across Europe?
I think, it's always a challenge of the European Union itself. There is a lot of heterogeneity in terms of what we can do, right? Building a true consensus at the EU level might be very, very challenging. But I think, at least with a smaller set of countries, there is something that potentially can be achieved. And that requires, important discussions in terms of coordination. For apps that already exist, then that's more challenging, but we are still at a phase, for instance, in France, where, this is not even on the table, I think.
All right, so just to remind our viewers, the reason we're talking about these apps is for confinement to be lifted, you need to have the population feel safe when they walk down the street. And listening to what Séverine Toussaert just said, Fabrice Epelboin, the answer will be a two-speed Europe when it comes to the rules of deconfinement?
Well, since those apps are going to be really mandatory when it comes to traveling, because if tomorrow I go to Italy, someone in Italy is going to ask me as a French citizen, are you going to harm us? And it's pretty legitimate. So there is going to have some sort of passport, I guess, between countries, showing that foreign countries that are not dangerous in terms of coronavirus. Therefore, the countries who will assemble together and who will share this kind of data or standard might shape something else than the current Europe, and there will definitely be a subset of Europe. It might not be the Europe we were seeing as a future, like a northern European country versus the southern European countries, because, well, since Spain and Italy are really much affected, they're going to work hard on the problem, and they'll probably be part of the solution. So it's going to be something very different from what we all expected from, we all thought that Europe was going into a dead end and thinking about a new way of assembling a Europe. And this is going to be different because of this virus. Very different, because we used to have a purely economical view on Europe. And definitely this view is failing as we speak.
Yeah. I very much agree with this. I mean, I think that, for instance, the Italian case, we've surveyed Italians in our study, and clearly they are even more inclined to use such an app, more likely to say, yes, I will definitely comply with safe isolation measures. But the Italian case now, right, might be the French case further down the road if we don't do anything, right? So there is really something here in terms of building a team and having communication there going on, because we can all learn from each other.
Yeah, and we saw with South Korea that they were spooked by 2015 when they had a coronavirus outbreak then. That's why they were ahead of the curve this time and learned the lessons of the past. And here in Europe, the future is unwritten. That study, Séverine Toussaert, that you participated in is in the magazine Science. I want to thank you for being with us from Oxford in the UK. I want to thank the confined Fabrice Epelboin for being with us from Paris. Thank you for joining us here in this lockdown edition of the show.